people joining, and that just makes me so excited. I see familiar faces, I see new faces, and that just makes me so excited that you're here to support this community and this event with us. So I believe it's recording, and we can continue. Our special guests here today are Tracy Rogers and Barb Hansen. Tracy Rogers supports Sanofi's Multiple Myeloma Journey Partner program and is here today to manage Barb's slide during her presentation. Barb Hansen is our key speaker, and she was diagnosed with multiple myeloma in 2006. She had her autologous stem cell transplant in 2007. The process for me was rather smooth, she said. The biggest challenge was that I was quite tired for several months afterward, and I was also dealing with bone problems caused by the myeloma. Her advice is to learn as much as you can about your disease and about your treatment options. It's not what happens to you, but how you respond, Barb says. Today, Barb enjoys walking, playing golf and bridge, and traveling with her husband. She is grateful that she can spend time with her 2 grandchildren, other family members, and friends. There was a time, she said, when I didn't think I would live long enough for the opportunity to be a grandma. She became a journey partner to give back by sharing her story that hopefully will encourage others in their journey with multiple myeloma. Today, Barb will be sharing her story of a stem cell transplant with us. We will leave time at the end after her presentation for questions or comments. I am so excited to hear from her. With that being said, Barb, the time is now yours. Barb, you're muted, so remember to unmute. I do that every session. You guys are used to it, so Barb, don't worry about it. There we go. We'll be able to hear you now.
Hello and welcome. My name's Barb, and I'm so pleased to be with you today. I'd like to thank Jenny and Audrey for inviting me to speak to you, the myeloma crowd. I'm here as a member of the Multiple Myeloma Journey Partner program, a patient outreach program sponsored by Sanofi Genzyme. There are 9 of us in the program, and we all have multiple myeloma, and we've all had an autologous stem cell transplant. We give unbranded presentations to multiple myeloma support groups such as this, healthcare provider groups, and we attend conferences where we speak to patients and caregivers up until COVID-19 hit, of course. In our presentations, we remind people that everyone's disease is unique. And the story I'm sharing today is my personal journey. A lot of it may not reflect your journey. So I think we're all set up on our screens. So I want to thank you, Audrey, for going over all of that. And so I like to get to know a little bit about my audience. So I won't see all of you, but you will see each other. And so how many of you have had an autologous stem cell transplant? Okay. Well, first of all, how many have myeloma? Just raise your hand. Okay. How many of you are here as caregivers? A very important role that you play. How many have had an evaluation for an autologous stem cell transplant? Okay, thank you. So during this presentation, I'll share my journey with multiple myeloma with you and provide information about myeloma and treating it. My story begins in 2006 when I broke a rib while stretching on my big red exercise ball. Thinking it was just a sprain, I didn't seek medical attention until a few months later when a nurse friend in an exercise class suggested I might have a sprain or a broken rib. I went for an x-ray and was then told that I had a fractured rib and to just give the healing process a little time. During that summer, I had my annual physical with my primary care physician, who focused on my increased blood sugar counts, thinking I had diabetes. She had me take a diabetes drug for several months, but it didn't impact my higher blood sugar counts. There was no unusual protein in my blood, and I didn't have an M spike, which is the case for about 10% of us myeloma patients. I had retired from Blue Cross and Blue Shield and was working as a part-time substitute teacher and was getting one cold after another. Chuck, my husband, was working as an insurance executive and new changes were coming to his company. We were looking forward to traveling, playing more golf, volunteering, and spending more time with our daughter in New Jersey and extended family in other parts of the country. That fall, we had taken a wonderful cruise in the Mediterranean where I was having some trouble breathing and had pain in my rib area and back when I carried my luggage. A month later, we took a family vacation with our two children, Kristen and Kirk. In the second photo above, we're celebrating Thanksgiving on a beach in Mazatlan, Mexico. Coming home, I could barely walk off the plane as my back really hurt. I knew something was wrong. I also had severe shortness of breath. Because I was afraid of getting a medical diagnosis since my husband was going to be laid off and we would be without insurance. That was back in the day when, we had the issue about pre-existing conditions. I had my daughter take me to see my chiropractor. After a few gentle treatments where I didn't have any cracking of bones, my chiropractor said I had a very strange cough, and he recommended I see my family physician. There I was sent for a second X-ray and then a CAT scan. I waited very anxiously for my results, even though the tech informed me that she didn't see anything suspicious on my CAT scan. About an hour later, I received a phone call from the nurse practitioner at the clinic I had been at earlier across the parking lot. She called and said I had cancer, and she was glad I had come in. She told me that I had a lot of lytic lesions in my ribs, a tumor on my fifth rib, and one on my collarbone. Then she gave me the name of a hematologist oncologist that I was to see the next week. All this on a Friday afternoon at 5:30. What a shock. A cancer diagnosis. I can remember calling Chuck and telling him I'd be late. We were having pictures taken for our church directory. And I told him, I want to go, just call them, tell them we're coming in. I wanted our picture taken, as I didn't know how much longer I'd be around. I couldn't believe how quickly my life and that of my family could change. That weekend, friends came over and our veterinarian friend looked at the CAT scan that I was taking to my appointment the following week. And he said he thought my only problem was that I was pregnant. That brought a little laughter. It was support of friends like this that helped us cope in a more positive way. I had a bone marrow biopsy the following Tuesday to confirm the diagnosis at the clinic recommended to me. Then I received some treatment for the bone disease and the high myeloma counts. The bisphosphonate treatments caused severe cramping that I later found out was due to leaching of calcium from my muscles. 2 thoracic vertebrae were then stabilized by vertebroplasty in radiology, where cement was injected into the 2 vertebrae, all under local anesthesia. Subsequently, I broke another rib when Chuck lifted me from the construction site to the ground at a duplex we were building where we had not yet put in steps. We both heard the ribs snap. I had no idea what multiple myeloma was when I was first diagnosed. The information on the internet was so overwhelming. I wanted to learn more, and I had a lot of questions. My first one was, what is multiple myeloma? Well, multiple myeloma is the second most common blood cancer, with approximately 30,000 new cases diagnosed each year in the United States. It's a cancer of the blood that develops in the bone marrow, which is where the blood cells are produced. There are 3 types of blood cells: white blood cells, red blood cells, and platelets. Multiple myeloma affects plasma cells, which are a type of white blood cell that produces antibodies that help fight infection and disease. Myeloma affects the blood and can affect the bones and the kidneys and causes many different symptoms or problems within the body. I talked to you a little bit about how my myeloma was diagnosed. In general, there are 2 criteria that lead to a diagnosis of myeloma. First, there are myeloma cells in the bone marrow. And then the presence of 1 or more slim crab criteria, which are 60% or higher increase in plasma cell infiltration of the bone marrow, the monoclonal kind. Then an abnormal serum free light chain ratio, 2 or more bone marrow lesions on an MRI, elevated calcium levels in the blood, renal or kidney failure, anemia, or lytic bone lesions, which appear as holes on an X-ray, which is what I had. The treatment for each person is going to be different because each person's multiple myeloma is different, and a myeloma specialist is going to recommend the treatment that they think would be best for each individual. There are several types or things that doctors consider before deciding the type of treatment to recommend for each individual. First is the stage and aggressiveness of the multiple myeloma. Then a person's age and overall health, the symptoms and complications that one is experiencing, and any previous treatment that the individual has had. The primary goal of therapy is remission. If a patient achieves that, the ongoing goal is to control the myeloma and extend remission as long as possible. There are many different types and combinations of therapy available today to help achieve these goals. When I first heard the word stem cell transplant, it was during a phone call with a case manager from my insurance company. And yes, we did continue to have coverage because my husband's company did retire him instead of laying him off, which we were very thankful for. The case manager informed me that a transplant was a common treatment for multiple myeloma. She said I should consider an evaluation. The oncologist I was going to at that time was not supportive of a transplant, so I was skeptical, and I put this option on the back burner when I first heard about it. Then a few weeks later, Frank, a new friend with myeloma, convinced me that I should attend a seminar on stem cell transplants given by his oncologist, a myeloma specialist. After the highly informative seminar, I asked the presenting physician about the treatment that I was currently receiving, which were high doses of steroids and an oral chemo. I hadn't received x-rays beyond the initial 2, and I hadn't had an MRI to determine the reason for the back and chest pain and the loss in height. and that was 2 inches. The presenting physician told me about kyphoplasty, where a balloon is inserted into the vertebrae and height can sometimes be restored on new fractures. He also told me about a new Mayo study that found lessening steroid intake was better. Within just a few minutes, I had already received excellent information from my conversation with this doctor. It was this connection that led me to his practice and a subsequent stem cell transplant. When I arrived at the new clinic after having my medical records transferred, the first test was an MRI, which did lead to stabilization of 5 new compression fractures with kyphoplasty. Since I hadn't had an MRI prior to see the myeloma specialist, these compression fractures had been overlooked, and by then the fracture had healed, and my height could not be restored. That was a tough moment for me when I learned that. Then after a few months of continued treatment with the same drugs I had been on to lower the myeloma cells in my bones, a stem cell transplant was discussed and recommended. One of the positives of having a transplant that was pointed out in the seminar was the idea of a drug holiday. I hated being on those heavy loads of steroids because they interfered with my sleep. Several days after the appointment, where we discussed the option of a transplant, I received a call from my doctor's nurse practitioner who told me about a 15-year clinical trial that involved a transplant and also taking a drug for maintenance. She said I might be a good candidate and asked me to think about this. When I heard the word transplant from my doctor's office, I did feel a little nervous and overwhelmed. In some ways, though, I was also excited because I was beginning to trust this healthcare team. The possibility of a drug holiday had already grabbed my attention, so I was excited to learn more about the transplant option and how it could potentially help me. My doctor explained to me why a stem cell transplant may be used when treating multiple myeloma. A higher dose of therapy may be recommended to kill as many myeloma cells as possible, but this also kills the good blood cells. The transplant doesn't actually treat the disease, but is necessary to help replace stem cells following aggressive therapy. Many people think of a stem cell transplant as receiving someone else's cells. This type of transplant is called allogeneic, or allo, and is used for treating some diseases, but very rarely multiple myeloma. In fact, only 4 to 6% of stem cell transplants for multiple myeloma are allogeneic. And this, the one that we use for multiple myeloma is often referred to as an auto, where your own stem cells are used. Many even refer to this type of stem cell transplant as rescue or support. And because the auto process uses your own cells, there are fewer risks and possible complications than there are with the allo stem cell transplant. So what is a stem cell and how does an auto stem cell transplant work? All blood cells start out as stem cells and are found in the bone marrow and blood. The stem cells grow and divide and become one of 3 types of blood cells: red blood cells, white blood cells, or platelets. A doctor may recommend a high dose of chemotherapy for a patient with myeloma, and this treatment then kills the myeloma cells as well as the good cells. So then a transplant is used to replace the blood cells. Let's look at how the autologous stem cell transplant works. There are several steps that happen before the actual transplant of stem cells. First, a patient will receive injections of one or more medications over several days to help move or mobilize stem cells from the bone marrow into the bloodstream where they can be collected. Next, stem cells are collected through an outpatient procedure called apheresis. During this apheresis, blood is taken from a patient through a catheter. After going through a special machine that removes the stem cells, the blood is then returned to the body through another catheter. The process takes 3 to 5 hours each day and is done on consecutive days until the required number of stem cells are collected. For most people, usually 1 to 5 days. The stem cells are then frozen until it's time for them to be infused back into the body. Some patients may proceed to this step right away. Others may complete the therapy first to reduce the amount of myeloma cells. And some don't have a transplant planned, but go through the apheresis process so their stem cells are available if they should decide to have a transplant sometime in the future. Some choose to do this because some of the therapies used to treat myeloma may destroy stem cells, and as a result, they may lose the opportunity for a stem cell transplant at a later date. In my case, I received treatment for the compression fracture and was on a regimen of drugs to lower the myeloma counts. I had apheresis for 2 days to collect my stem cells in an outpatient setting. Then we have high-dose chemo. Prior to infusing the collected stem cells, a patient undergoes high-dose chemotherapy to kill the myeloma cells. The high doses of chemo will cause side effects. Before and during this treatment, medications will be given to address some of the side effects, and fluid is given through IV to prevent dehydration and kidney damage. 1 or 2 days after completing the high-dose chemotherapy, the collected stem cells are thawed and returned to the body by IV. The infusion usually takes 1 to 4 hours. The chemotherapy and transplant steps may be done inpatient or outpatient. Then we have recovery. The infused stem cells will travel through the bloodstream and eventually to the bone marrow, where they begin to produce new blood cells, also called engraftment. A patient will be closely monitored during the first couple of weeks following a transplant. During this time, when the red blood cell, white blood cells, and platelet levels are low, there's a high risk for infection and bleeding. The patient will also feel weak and fatigued, and a blood transfusion is sometimes needed. It takes approximately 2 weeks for blood cells to return to a safe level. Even after blood counts recover, it still takes time for the body to completely recover. If done as an inpatient, the average time spent in the hospital for chemotherapy, transplant, and recovery is approximately 3 weeks. Recovery will continue at home for several months following the transplant, and patients should continue to avoid situations that would put them at risk for infection or injury. It may take 2 or 3 months to completely recover physically and regain strength and energy. Although all medical procedures carry a risk, there is less than a 1% mortality rate associated with an autologous stem cell transplant. So my decision to have a stem cell transplant wasn't an easy one. I was presented with the recommendation of having this transplant as part of a clinical trial in 2007. The purpose of the trial was to see if taking a maintenance drug after transplant would extend the time of being disease-free or called progression-free survival. After doing some research at home, my family and I met with my doctor, my new oncologist, a myeloma specialist, and the transplant coordinator to discuss the risks and benefits of going through a transplant and of being in the clinical trial. After some discussion with our family, with all of us agreeing that the transplant was going to be a good option for me, and feeling quite confident myself about the decision, I signed the consent forms. The first step was to go through restaging, where I had another bone marrow biopsy with cytogenetic testing, x-rays of my skeleton, an echo exam of my heart, a CT scan of my sinuses, and a PFT exam of my lungs. I passed all these tests and was approved for the transplant. When I had the lung exam, I was so nervous and just thought I might flunk, but luckily I passed. Anemia was causing shortness of breath. The next step was the line placement with sedation. Chuck and my backup caregiver, Diane, had been trained earlier on how to flush the line, so we were a go. The next morning, I arrived at the clinic for injection of a drug to increase stem cells in my bone marrow and blood. My bones ached from receiving the drug. My friends then helped me shop for a wig since I was told I would lose my hair. I cleaned my house thoroughly and prepared to spend 3 weeks in an outpatient facility. That evening, we had friends over for dinner, knowing it would be some time before we could have this kind of celebration with wonderful support in our home again. It was kind of a send-off for me. The next day was quite an emotional one, though, as my husband shaved off my thinning and falling out hair. I didn't think hair was that important, but, you know, it is. It's kind of an emotional thing to lose your hair. A few days later, I got the call that apheresis was a go. My stem cells were collected over 2 days, 14 million of them while I was an outpatient. They were then frozen at the hospital associated with my clinic where I received treatment. I then received the heavy chemo infusions over 2 consecutive days. When the nurse put on the big heavy gloves and asked me my name, I became a little apprehensive. What was it that she was giving me that required heavy gloves? Going through this process at times produced some anxiety for me. But then 2 days later, on October 19th, 2 bags of my thawing stem cells arrived in a bath on a cart, and I received them back through 2 injections into the PICC line. I was more confident about my decision to have a transplant. A group of nurses then surprised me when they came into the room and sang happy birthday to me. I had just received my new immune system. Wow. Did that bring a smile to my face? Throughout this process, I was treated as an outpatient and spent 3 weeks with my caregiver husband at a hotel where I would be within 30 minutes of the hospital in the event I developed an infection. I had visits from my children and friends who also served as caregivers for Chuck, which allowed him to take a break and go to our home and run errands. Every day we were at the clinic and I was closely monitored for blood counts and given hydration and anti-nausea medication. During this time, I was extremely tired, but I received wonderful support and encouragement in the clinic. There were mornings when I was so tired, I literally had to be rolled out of bed. Girlfriends did give Chuck a break also by coming to the clinic to pick me up, and on several days we did go out to lunch. Me eating only cooked food and the 2 of us sitting at a table in a quiet corner. My doctor couldn't believe I was up to this. Excuse me. As stem cells started engrafting around day 12, I gradually regained my energy. As I was doing quite well, and after confirming no signs of infection, I was released to go home early. There I continued to recuperate slowly, regaining strength and able to participate in more activities. Then 3 months later, I received the good news that I had attained complete remission. I also started taking the clinical trial drug at this time. I was given either the study drug or a placebo, a 50% chance of getting either one. Then approximately 18 months later, the study was unblinded because of promising results, and I was told I was on the study drug. I suspected this as I was familiar with the drug, the same one I had been on during induction. Through my journey with multiple myeloma, I've learned that there are important, helpful steps to take, and I recommend these to anyone who has been diagnosed with multiple myeloma. The first is to educate yourself. I found that the more I learned, the more empowered I felt. For me, it ended up being really important for my treatment that I began going to a doctor who specialized in multiple myeloma. And it was here where I learned also to become my own best advocate. Patient navigation services are also a great resource to help with education and to navigate you through the journey. Many centers are developing patient navigation programs, so find out if one is available to you. And you've probably already discovered multiple myeloma is a complicated disease. Even though my doctor did a wonderful job explaining it to me, it was a lot of information and I was overwhelmed. And being diagnosed with cancer, there's a lot of emotion that can be triggered. So it can be difficult to focus on everything your doctor's saying. If you bring someone with you to your appointments, there's someone else who is hearing the same information and can take notes. And that person might even have questions that you hadn't thought of. Doctors want to help their patients to make the best decisions. They need to know everything that's going on with you. So don't hold back. Let your doctor know how you're feeling and what symptoms and complications you're experiencing. Even if it seems minor, be sure to share it with your doctor so he or she has a complete picture and can do their best to help you. In between your appointments, you will probably think of questions. Keep a list of these questions and take them to your appointment, or call if you need an answer right away. And there are many resources out there that provide information and support. As part of my presentation at the end, I am going to share some resources with you. The last recommendation on this list is to have an evaluation at a transplant center. Going for an evaluation doesn't necessarily mean that you're going to have a transplant, but it's an opportunity to learn more about this treatment option. Even if you don't think you would want to have one, it may be helpful to have an evaluation to find out if you're eligible. Knowing that you've investigated every type of treatment or all the possible ones that you hear about can rule out those that aren't options for you. This will help give you peace of mind as you move forward with your therapy. And if your doctor doesn't recommend an evaluation at a transplant center, it's okay to ask for one. A transplant specialist can determine if you're eligible for a transplant and if they would recommend one for you. They may also discuss collecting your stem cells now to possibly use for a transplant in the future. The transplant specialist will work closely, and this is really important. The transplant specialist will work closely with your primary oncologist, and together They will determine the best course of treatment to recommend you. When I met with my physician to talk about a transplant, I had many questions. Once my healthcare team recommended that I have the transplant, and it was determined that I was a candidate, I had even more questions. It was important for me to understand the process and know exactly how my life would be impacted as I went through it and afterward. I asked many of the questions on this list, and you may have some of these questions and more. Will I have to stay in the hospital at any point? And if so, for how long? And for those of you who may not live close to the transplant center, there may be questions about where you and your support person can stay, so there's not a lot of driving back and forth. You may wonder how you're going to feel during the various steps and when you would be able to go back to work. My nurse navigator was immensely helpful. If you do decide to have an autologous stem cell transplant, be sure to find out if the transplant center has a coordinator or a nurse navigator. Then, if you're eligible and choose to have the autologous stem cell transplant, there are several things you may experience throughout the process. As we discussed earlier, the high-dose chemotherapy that is given prior to the transplant kills the good blood cells along with the myeloma cells. The transplanted cells help to replace the red and white blood cells and platelets. But in the weeks following a transplant, white blood cell counts are still low. You may experience fatigue and will also have a higher risk of infection or bleeding. Doctors may give antibiotics or a blood or platelet transfusion to help with these side effects. Additional possible side effects from the high-dose chemotherapy include nausea, loss of appetite, and mouth sores, as well as other serious side effects. Please always consult your doctor about any side effects you experience. Ultimately, I believe that an autologous stem cell transplant was the best treatment for me. These are some of the things to consider when deciding whether to have the stem cell transplant. Although we hope there will be a cure for multiple myeloma one day soon, there isn't one at this time. And a stem cell transplant may improve the length of remission and survival and may improve quality of life. Some studies have shown that early stem cell transplantation improves treatment outcomes. The National Comprehensive Cancer Network recommends that everyone who is diagnosed with multiple myeloma have a transplant evaluation. The higher dose of chemotherapy that is given before the transplant can kill many more myeloma cells than conventional lower doses. An autologous stem cell transplant uses the patient's own stem cells, which means less risk for infection and complications. Oftentimes, enough stem cells are collected in 1 or 2 days. It's now been 13 years since my autologous stem cell transplant, and I've been in remission 12 of those years. I feel extremely fortunate to have had all these years and have been on a drug holiday for about 7. Now the average life expectancy is upward of 10 years, whereas when I was first diagnosed in 2006, it was about 3.5 years. My myeloma-free light chain counts, and that's how my myeloma is monitored, have increased a little. And I've heard that I am in the smoldering stage now. A recent PET scan and an MRI shows no new lesions, for which I'm very thankful. But the bone marrow biopsy shows 30% monoclonal plasma cells. Since I don't have an M spike, My myeloma is measured by the free light chain test. Every 2 months, my blood is tested to see how the kappa light chains measure against the lambda light chains. My doctor and I continue to discuss treatment options should my myeloma begin to misbehave again. My doctor and I are also hoping that there will be a clinical trial in our area that I can qualify for when and if the time arrives when I will need treatment. I continue to have some side effects from the drug that I stopped taking 7 years ago, including leg cramps. There are drugs and pickle juice that work somewhat to help alleviate the side effects. Life is good as I continue to enjoy time spent with family and friends that also include our lovely daughter-in-law, Kirsten, and now, especially with my 2 grandkids, Forrest, who is 8, and Estelle, who is 6. I'm also somewhat active in sports and bridge, and I love walking in my neighborhood and climbing the hills behind our house. After 2 years of physical therapy and fascia treatment for pain, I have been able to play golf again. We like to travel a bit and visit family in other parts of the country, and especially our daughter in New Jersey. Haven't been there in a while, though. She's, anyway, it's that time. We also like to do volunteer work in our community and our church. I try to be careful about being around people who may be sick, especially right now, because as my oncologist explained to me, my immune system will never quite be 100% again. I am very appreciative of all the wonderful researchers, medical, and support people who work tirelessly to bring new treatments to us patients. And I appreciate all the healthcare workers who have made a difference for me. I have been blessed by all the fellow survivors and caregivers like you, who I have met along my journey with cancer. Today, I try to give back by sharing my story in hopes of educating and empowering others. In fact, it's my current myeloma specialist who encouraged me to be a patient advocate. And I'm very thankful for that little chat we had quite a few years ago. I do love to talk as a multiple myeloma journey partner to people in groups such as this. I also volunteer with the First Connection program of the Leukemia and Lymphoma Society, where I have phone conversations with women all over the country who are newly diagnosed with multiple myeloma or who request to talk to someone who has the disease. I feel honored to hear other people's stories and hope that we can continue to fight this disease together. After leaving today, I hope that my story will encourage you all and lend the amount of hope you need to continue with your own journey. As mentioned earlier, there are some wonderful resources available to help us navigate through our journey with multiple myeloma. And it's our responsibility as patients to learn as much as we can about our disease. Gaining knowledge about multiple myeloma empowers us to have more meaningful and confident conversations with our healthcare team. I strongly encourage you to look into some of these resources. So thank you very much for attending. And I'm now happy to answer your questions. And please remember that I'm a peer and not a healthcare provider. And just jot those questions that you have that are medical and take them to your appointment next time you go. Thank you.
Thanks, Barb. Thank you for that presentation.
You're welcome. My pleasure.
There were some great resources on that slide, and Myeloma Crowd was not on that slide, but it's also a great resource as well. Barb, I really liked just how you navigated between the personal and the technical stuff. and I'm really excited to get talking about your questions. So the way that we're going to do this is we're going to use the raise hand feature. So if you move your mouse to the bottom of the screen, a white bar should appear. You should see the raise hand icon. If you're on a phone, you can also just simply tap the screen. Buttons will appear near the bottom of your screen, and there should be a hand feature that you can press if you have questions. I did see one question in the chat, so we'll start with that. Carol says she's curious about high risk factors and post stem cell transplant. Any experiences or resources to check?
To check high risk? Well, I was tested with a cytogenetic testing, and that's as much as I know about that. And I now have 2 clones that are there in my cytogenetics. And I guess that's what causing me to be in a smoldering stage where, you know, when I was first tested, we didn't have MRD testing. And, but I was considered to be in complete remission. And so
I think the question is more and maybe we can ask the audience here, has anybody been through a stem cell transplant that was high risk, and how did that go?
Oh yes, I've heard of people with high risk factors who have been through a transplant, and I would have to refer that to the medical people, the researchers, and the doctors. But I do know that there are people who are doing quite well with high risk factors who have had a transplant. Yes.
Thank you. I see that Rosalind Weinberger raised her hand, or Weinberg, excuse me. So Rosalind, if you want to unmute yourself, you're welcome to speak. And again, you unmute yourself by either tapping the screen or moving your mouse to the bottom of the screen and clicking the microphone.
Can you hear me now?
Yes, ma'am.
Yes, I had autolytic stem cell transplant on January 28th. I had to wait an extra year because I also have breast cancer, and I needed mammectomy. Yes, that was after being treated with Kyprolis for 6 months. And I was getting ready for transplant when I discovered a lump. And so I had to be treated for myeloma for 7 months until I was well enough to go into surgery. And then after that, none of the myeloma drugs seemed to work on me. And they were giving me stronger and stronger meds, putting me in the hospital each time until I agreed to transplant. So they gave me Cytoxin and Kyprolis. And I've never been in remission because my myeloma was ignored for 3 years. It sounds like it's not an unusual event, probably because they were looking at the breast cancer problem. And when I said I had pains in my bones, I was sent to a sports medicine doctor. Anyway, I am about a month, 2 months, not quite 2 months out of transplant. I've been told I'm eligible for a COVID vaccine next month. So that's going to be interesting. But I will have to be revaccinated with all childhood vaccines by July. Barbara's historical aspect is interesting because, of course, now you can't be an outpatient doing transplant.
Yes, exactly.
In an isolation ward. Although my daughter was allowed in, she wore a mask all the time. She's part of our bubble. But they were pretty pleased with the outcome. I noticed, of course, that the drug that they give you, and I know what that is, as I'm a chemist, is really strong, and it did kill all of the cells for at least 2 weeks. But I have a very aggressive cancer, and so I have no idea what extent of remission or how long. But I'm considering feeling pretty good at the moment, although I was feeling pretty terrible when I came home. They do now give steroids for short periods of time if you do have those post symptoms, and you should tell your transplant doctor about it if and when you come home from transplant and you are not progressing as you feel you should. Don't be shy about going back and saying, look, is this normal? And it's nice when they say yes, and we can try X, Y, or Z. So I think I agree with Barbara. Be proactive, learn as much as you can, and do what you can. And good luck with everyone else who's going to go through this.
Thank you.
Oh, is there an echo? There was an echo. I don't know what happened. She said something important that I want to emphasize, and that's that during this, because of the consequences of the pandemic, lots of people have limitations, including stem cell transplants look a little bit different. There are no outpatient stem cell transplants at this time. There's only inpatient stem cell transplants. And then you do go into an isolation ward, and you do have to have 100 days of isolation. So it looks significantly different than when Barb did hers. That isn't to scare you away, but it is to make sure that you talk, when you're getting your evaluation, that you talk about what are the consequences of COVID-19 right now, how would that affect me in my stem cell transplant recovery process. We have Mike H. that raised his hand. Mike, would you like to unmute?
Yeah, thanks, Barbara, for your presentation. That was good. I just wanted to ask you, why did they scan your sinuses? The reason I'm asking is because I've had serious nasal polyp problems for the last couple of years, and I've just been recently diagnosed with multiple myeloma. So it's kind of the two of the things are sort of tied and very much in my front of my mind.
I think scanning my sinuses was to see if I did have any infection, because you wouldn't want to go into this transplant with an infection. So I guess that was the reason. I was surprised myself that was the only part that they scanned. But I'd had a full body skeletal survey. I had not had a PET scan. I had my most recent PET scan, probably 3 months ago, and that was only my second PET scan, but now they're using PET scans more frequently, I believe.
Thank you, Mike, for your question. Hopefully that answers it a little bit. Hannah N is next. So Hannah, if you want to unmute. Oh, Hannah, okay, there we go. There we go.
Barbara, thank you for your wonderful presentation, sharing your story and doing recommendation.
Oh, thank you.
I'm glad that you are doing good. So being now short, I was just diagnosed in August 2020. Otherwise, whole life, 67 years old, I was healthy, never hospitalized, never broke anything, never any sicknesses, and then boom, myeloma, okay? Pretty word, I like the word myeloma. So now I was given standard treatment that helped me because I was in bad stage, really, I didn't have genetic high risk, but I had problem with bones. Myeloma was showing on the PET scan pretty everywhere, but I didn't feel the pain. The doctors were like, why you don't feel the pain? I don't know. I haven't anything broken. So my doctor, who is not myeloma specialist, but is hematologist, and he started me on standard treatment RVD that after 3 months made big progress, and I was in very good partial response. After 6 cycles, I'm on CR, which means complete remission, right? But I'm waiting for tests to say maybe I'm complete remission. And also I did recently my bone marrow test, and it was sent for MRD. So knowing all of this, and they want to do outpatient autologous stem transplant, and knowing that otherwise I feel so healthy, I don't have any side effects, and I am vaccinated twice in January 29. I get second doses of COVID medicine, and I feel that my immune system collected through my life memory immune that is going to be completely erased when I'm going to be given this harsh, chemotherapy. And also, now they starting to have more targeted chemotherapy that is not going to destroy your healthy cells, only is going to target your myeloma cells. So knowing all of this, I'm hesitating to go through transplant. And I told my doctor, I would like to collect my stem cells for that time once I'm not heavy medicated. But I'm having hard time with this, like they want to push me through the whole process. So what you think?
Oh, I know that's got to be a tough one. It's such a personal decision, and a decision that a person needs to make with their family and definitely with their healthcare provider team. I just know it was the best option for me. And this is where learning as much as you can about the process is very important. And talking to other patients, perhaps, other people, although, like I said at the beginning, everybody's journey is so different. I guess I do know that, which was one of the bullets in my presentation, is that the transplant kills a lot of myeloma cells that maybe we don't even know about. Because there's no cure, but you did say that you tested MRD negative.
No. I'm awaiting the test, but what I know that I'm in complete remission. Yes.
And I was too. But now my myeloma has started coming back, but I've had 13 years with the transplant. And for me, that kind of speaks for itself. It was a very good option for me. So that's really all I can say. Everybody has to make their own decision.
Thank you, Barb. I agree that it's, kind of like what Barb said, it's a very personal decision. I loved what Barb said, that you need to learn as much as you can. So I'm really glad that you're here to learn more. And then we can even have somebody from our team at the Myeloma Crowd reach out to you and even give you more resources about stem cell transplant, because I think it's just important to know as much as you can. Something important to note, Barb, I love that you're saying that it was the best option for yourself, because it it's everybody's personal decision. And there are actually very differing opinions right now in the multiple myeloma specialist field, that some people believe, we've had in different roundtables, that some multiple myeloma specialists have said that SCT won't be standard care therapy anymore, and that they're not going to be recommending it as much to myeloma patients, where other multiple myeloma specialists say we're going to continue that. So seek second opinions is what I would say. If you are feeling pushed, go with your gut. Don't ever be pushed into a decision. Make sure that you are being your own best advocate and make that decision, as Barb said, with your family. Learn as much as you can. Make sure it's your personal decision, because you can have a stem cell transplant and it might be the best option for you, but don't ever be, and this goes for everyone, don't ever be pushed into a medical decision that you're not comfortable with. Make sure that you are your own best advocate when it comes to that. So thank you. Thank you for sharing that.
Thank you.
And could I just say a good point that you made, Hannah, is have an evaluation and have your stem cells collected. It opens up that opportunity for you if you need it later on.
If you choose it, yeah, I agree.
Yes, thank you.
All right, we have, thank you. Gail, we have Gail who's raised her hand if you want to unmute and share with us. I don't see Gail. All right, right now we'll move on to Judith Morris, and then Gail, we'll get to you later if you can hear us. Okay, Judith.
It's actually my husband, but he couldn't get this phone.
No, it's okay.
Steve Morris. Okay. I don't know why my picture's not up there because our camera's on.
There you are.
No, I can see your picture.
All right. So my husband's going to ask the question. It was about, do you want me to ask?
Yeah, sure.
Oh, it was about ready to start his evaluation. He's in his fourth cycle of that VRD.
Mm-hmm.
VRD takes Darzalex. I forgot the other name for Darzalex.
Mm-hmm.
And at the hospital he's being treated at, they do the entire process, they told him, as an outpatient. And I'm very concerned about this, both for me as the caretaker, having him home during this, the whole process, unless we interpreted it. They said because of COVID, they found it to be a better system than being in the hospital. I don't know if they have an isolation ward or section in this hospital, and it's been very nerve-wracking from the beginning because of COVID. And every time in the beginning, he had to go into the hospital like 2 or 3 times a week, or an N95 mask and a shield, and be careful when he came home that we washed everything. He took a shower right away, and we've been lucky, knock on wood, but he has not had his inoculations, the vaccine, because we decided he was so close to possibly being approved for transplants, and it would wipe the vaccine anyway. And they say in blood cancers that the vaccine, because your immune system is so suppressed anyway, that they're not even sure you can mount get antibodies against the virus. So we figured, what's the sense of taking it? Because we also have a lot of questions about the vaccine in itself. I've taken it.
Totally understandable.
Which I wouldn't have it necessarily, but I took it on the caretaker, and I wanted to make sure I was vaccinated. So anyway, I wanted your opinion on, because you're saying you should be in 100 days isolation, you mentioned. Could you, because he has his first appointment on Monday with the evaluation. So I want him to be able to get this straight about what is the right approach.
Yeah, right is hard because everyone has their different rights. I can just go off of what I have seen and what I understand to be typical protocol in the medical world at this time for stem cell transplants. Again, I am not giving medical advice. This is just what I have heard. It is hard because a lot of people do get COVID from going to the hospital, like that has been proven. So I understand what your hospital is saying. My best recommendation would be to seek a second opinion and then go at a different hospital and then go with whatever your gut tells you to do. whatever, consult with friends and family again, consult between each other. If the second, I would search for a second opinion, because what's normally happening, and I'd love to hear back maybe in the chat if you guys can share your experiences from what you've heard, but what I've personally heard and seen over the last year is that they're doing inpatient, and then so they harvest the cells and then they give back the cells and then they move the patient to an isolation ward. And then they are in that isolation ward for around 3 weeks. And then it could be, and then they go home, and then it's 100 days isolation. And I think 100 days might include that 3 weeks. It really depends on what your treating physician says. And then, those days of isolation at home are, you don't invite over friends and family, you don't go out, and things like that. So that's
difficult, because we've had, in addition to the hospital that's treating my husband, we've had telemedicine calls with 2 other. One is Sloan Kettering, which I would say has a pretty good reputation.
Yes.
Told us that they're doing it as outpatient now. And other hospital, which I go to, but it's a 3-hour drive from my house, and it would mean staying there for months in another.
Right.
And it's not the easiest thing to do.
I'm being treated at Vanderbilt. They have their patients, for the most part, live in Nashville or the area of. So that's why they told me that they don't have inpatient stuff, because most patients are not transient. They live here. So I just want to go 2 things. Number one, we have, having the head of the department at University of Alabama in Birmingham and Sloan Kettering monitor me. They all agree with Vanderbilt.
You're cutting out, so I can't hear you.
But the thing is, they've been monitoring his treatment. They've agreed with the treatment thus far. But the University of Alabama, which personally I really like that doctor, but we've never met him. We've only had 2 telemedicine calls with him. But there's a big difference in how responsive he is, and the hospital and how it's set up. He said they do keep the patients in the hospital for about 14 days during that period. But he said it's because most of his patients come from out of town, and they don't have their own homes to go home to. I don't know if this is the new thing because of COVID that they're doing it. It's scary for me.
It is.
Come home and I'm petrified. I won't clean something the right way. I won't give him the right treatment. Something will happen. That's another thing I'm afraid of. In the middle of the night, he might spike a fever. And right now, all they do is tell you, go to the ER. I'm not taking him to the ER when he's in the middle of a process. So I don't know.
It's okay. I understand what you're saying, and I'll connect with you offline as well, and we can talk more about this. And I can even get you in touch with some coaches that have been through stem cell transplants recently, and they can share with you their experience, and we can talk more about this offline, because I want to be respectful of everybody's time too. Yvette, did you have anything to say before we go? I know you were raising your hand earlier, so I didn't know if you wanted to say something quick.
Okay, real quick, I would like to tell Ms. Barbara, I too am grateful for your presentation. I may be going through mine. I did my bone marrow biopsy last Tuesday, so I got like probably another week to find out when I will start my transplant process. I'm 60 years old. I was diagnosed in October. My doctor told me that because of my age, it was the best option to give me a longer life, and that's what we all want, you know. I was going to ask the question that Miss Judith asked, so thank you for asking about the 100 days, because I was told that it would be about 2 to 3 weeks in the hospital and then 24/7 care for 30 days. My daughter will be at the hospital with me. My mother will come to my house and stay with me for the 30 days.
Good.
And then I was like, well, where did the other 60 days come from? But now I understand you have to just stay away from people, which I've already been doing for almost a year now.
Yeah.
So, all right.
Yeah.
Thank you very much.
Yeah.
Well,
And again, I'm not trying to give medical advice when I say the 100 days. I'm just going off of previous experience.
I can do that.
Okay.
On one leg, hopefully.
the best to you, Yvette. The best.
Thank you so much. Thank you.
All right, everyone. Thank you so much. And I'm sorry we didn't get to everybody's questions. I'm excited. I will contact those that I've talked to. I'll look in the chat and answer directly things that I haven't been able to answer. So thank you again for participating with us. I just have a couple outro announcements and then we'll be done for today. But again, thank you for sharing this time with us. And I apologize for going over, but I'm excited that we could have this real discussion because I feel like that is needed.
Thanks, everybody.
So our next newly diagnosed myeloma patients event will be on April 22nd, 2021. And we will be talking about how to avoid TMJ, which is temporomandibular joint syndrome. It's really common, well, really common is an exaggeration. It is common in multiple myeloma patients, and that's why we take Zometa and things like that. So promise to keep you updated about this event. Upcoming events in our myeloma community program. On Saturday, March 20th at 12 p.m. Eastern, we have a myeloma crowd roundtable. We're going to be talking about what's next, decision-making for relapsed refractory myeloma. It's important to know even now in the newly diagnosed stage, what you would do if you do have a relapse for those that are in complete remission. It's always just better to be empowered with knowledge. So feel free to attend that. Wednesday, March 24th at 1 p.m. Eastern is our Selinexor support group chapter. We're going to be talking about how Xpovio works in your body. Xpovio is the brand name for Selinexor. On Thursday, March 25th at 1 p.m. Eastern is the plasma cell leukemia support group. We're also going to be talking about what to do at the time of relapse. And on Thursday, March 25th at 2 p.m. is our African American myeloma chapter. We're going to be talking about myeloma 101 within the African American community with multiple myeloma specialist, Dr. Craig Cole. Another thank you to our community event sponsors, AbbVie, Bristol Myers Squibb, Amgen Oncology, Genentech, Karyopharm Therapeutics, Adaptive Biotechnologies, and Takeda Oncology. And thank you so much for helping us build the strong myeloma community. We appreciate all of you, and we thank you for coming. Thank you so much, and have a great rest of your day. Thank you for spending this time with us.
Bye-bye.
Thank you.